everyone. Welcome to Senior Moments. I'm Linda Brayman. I always think of November as the month for gratitude. It's a time we can reflect upon some of the things we are truly thankful for, such as family. I'm sure you can think of a whole host of other things, but don't forget Senior Moments. We are always here and grateful for you, our viewers. Senior Moments covers events and activities at senior centers in the Ann Arbor Ypsilanti area, such as the Ann Arbor Senior Center, Turner Senior Resource Center, the Pittsfield Senior Center, and the Ann Arbor Community Center. Also, the show provides valuable information for senior citizens on such issues as health, wealth, finance, and entertainment. Senior Moments is a monthly show. It premieres on the last Sunday of the month at 5 p.m. and it reruns 10 times a week on CTN Channel 16. Please check out our website, a2gov.org/CTN, for the playback schedule. Also, you can watch the show on YouTube. Please log on to youtube.com/CTN Ann Arbor to view the current and archived shows. And now, it's time for the November program. We hope it is just the remedy you need this month to lift your spirits and give you something positive to focus on. Enjoy.
Hello, I'm Brigitte Maassen for Senior Moments. Our guests today are Dr. Sherry Day and Ashley Howson from the University of Michigan's Kellogg Eye Center, and we will be talking about low vision issues. Thank you so much for taking the time to give us advice about low vision. Before we begin, please tell us about what work do you do at the Kellogg Eye Center?
I'm a clinical assistant professor at the Kellogg Eye Center, and my primary roles are I'm a doctor in low vision services as well as contact lens service. And so the bulk of my day is spent working with our low vision patients. And this is Ashley.
I'm the occupational therapist in the low vision clinic. So I do low vision rehabilitation, and I get my referrals from Dr. Day and Dr. Wicker, our low vision optometrists. And I also help facilitate our Living with Low Vision support group, which is a monthly meeting. And I run an annual fall prevention class called Matter of Balance.
Okay, so what is low vision?
Low vision, practically speaking, is just anyone with suboptimal vision. So we talk about being 20/20 vision, which is our normal vision, our normal standard testing vision. But anyone with 20/40, 20/30, even 20/70, 80, those are all can be considered low vision. It's more of a functional issue. There is also the definition of legal blindness, which is 2200 or worse in the better eye, or the total visual field is 20 degrees or less. We also see those patients as well.
Oh. And what type of services do you offer at the Kellogg Eye Center for somebody living with low vision?
So primarily when they're referred to the low vision clinic, Dr. Wicker or myself, we are the optometrists who evaluate the visual status. We focus our exam on the visual goals of the patient. So for example, what is the bulk of your activity for the day? A lot of our patients want to read, or they need to see their children, they need to drive, or they watch TV, or they're working on the computer. So we customize our exams for the patient. So in addition to the exam, then they have time to work with Ashley, our occupational therapist, on rehabilitation and device training, whatever devices that we prescribe. Aside from Ashley, then there's our social worker, and then we have a orientation mobility specialist at the university.
And who should get a low vision exam?
Well, anyone with suboptimal vision that is having any difficulty functioning. So even somebody who is 20/30, just a little bit off, and then 20/70 in the other eye, it seems like they can function with 20/30, but they're having now depth perception issues. Anyone like that can come into our clinic.
So basically, you'd find out yourself all of a sudden, I can see well, I can read. So that probably would tempt you to go and ask for examination?
Right, so usually patients like that would already been examined by other eye doctors, ophthalmologists, optometrists, either in Kellogg Eye Center or outside in the community. Most of our patients are referred to us, but there are some patients who have heard of the service and just refer themselves in.
So what does a low vision exam entail?
So the low vision exam with Dr. Wicker and myself is about optical devices. So we assess the vision, we see what devices or magnification would help them achieve their visual functional goals. And then we have Ashley work with them.
So what are some of the low vision devices? I know you brought some today,
Yes.
which probably would be helpful.
Yes, so traditionally you have magnifiers for reading and near, and this is one of them. This is a handheld magnifier. You could take it out, you could hold it with your hand, but you can also set it on a stand like this. It becomes a stand magnifier. This is just a sampling of the many devices we have. So traditional magnifiers for reading. We have some distance devices, telescopes. Also, this one is for watching television. It's a 2x magnification. It can focus individually, each eye separately. And this is the clip-on version. So since you wear glasses, for example,
Yeah.
we would test this on you.
Oh,
And this is another one where we put it on the table, the light can come on, and it can magnify. You can read right above here. So nice and simple, but so it's also very, we like the design too. There are also traditional contrast enhancement or glare control. This is one. It's a lighter, you can see how this is a lighter shade.
Yeah.
This is more for indoor glare. So a lot of our patients, depending on various eye diseases, will be very light sensitive indoors. For example,
Right.
if they go to the grocery store,
Yes.
all the fluorescent lighting,
Yeah.
they could try something like this. And outdoors, a lot of glare outdoors with the sun, especially Michigan weather
Much
with
darker,
the
right,
with the snow
yeah.
and the sun. And then of course we have electronics, and I'll have Ashley kind of go over some of the electronics that we brought.
yeah. So what does low vision occupational therapy, what do you do in
Yeah.
therapy?
So Dr. Day touched a lot on the fact that we are
Right.
really goal oriented. So when someone comes in to see us, they usually have specific goals and things that they would like to be able to do that are meaningful to them in what we call their activities of daily living. And so my goal is to assess those needs and help them compensate for some of their vision loss to be able to achieve those goals, learn how to use new devices, maybe learn about new tools that could benefit them. And then I also can do home safety visits or home training. So if people get devices or, are having difficulty with things like computer work or that, within a small range around the Kellogg Eye Center, I can actually travel to the home and help put some of those things into place.
I think we're very fortunate nowadays that there's so many the devices are helpful than
Yeah.
we used to be like this.
Yeah.
And then the other question, does insurance pay for this?
Great question. So typically, insurance does not cover the devices, but they do cover the time. So they will cover the evaluation, the low vision evaluation, and then the occupational therapy is just like any other rehabilitation. So if your insurance covers OT, we can usually get that covered. The devices are typically out of pocket.
Are they very expensive?
It ranges, yeah, it ranges. There are some magnifiers that are, $25 to $50. There are some magnifiers that are $300. And then electronics can be anywhere from $500 to $10,000, just depending on what you need. But we have a lot of options in clinic for that very reason. We can find what works at each price point to meet each goal. So it's really individualized to what,
I happen to see a little computer. Is that a special device?
Yes.
Yeah, so this is an electronic reader, video magnifier. These are really wonderful because you can not only adjust the magnification, so you can make the print larger up to, I think this one goes up to like 22 times magnification, but you can also change the color contrast. So you have some different high contrast settings that some people find help them to see a little bit better, and then back to the normal color mode for things like looking at photos and pictures. There are also some higher tech electronics that we have and can demonstrate, like the Orcam. And the Orcam is a device that attaches to a pair of glasses, and with a series of hand gestures, it will actually read information to you. It talks into your ear, and it can identify faces, it can scan barcodes, and do a lot of different things. So this is one of those that I was talking about that's a lot more expensive.
I would assume, right?
This one I think is about $3,500. Yeah.
Wow.
And it requires some training and practice. So we like to show people in clinic and have them try it before they, invest in a large product like this. And then this is eSight. So we get a lot of questions about the wearable electronic devices, because this is something like this that can go with you anywhere. It can focus up close or far away, and you wear it like a pair of glasses and then control it with a remote control. And this one is about $7,000, I believe. So again, we like to have people come in and try them on if they're interested in the technology, and that way we can make sure it's a good fit.
So this is similar, more advanced than the other one.
There's two little cameras inside that capture, similar to this, and then you can adjust the image that you're seeing. So you can make it bigger, you can change the color, you can do a lot of cool things.
And this one is distance and near autofocus as well, and you can change the contrast just like with this.
I think that's wonderful. I mean, if you really have a vision problem, and at least there is help,
right?
So so I think the other question we had was, how about home safety evaluation?
Yeah, so I mentioned that we do offer home evaluations for our patients in the low vision clinic, and when they've had the low vision evaluation and it's determined that maybe they're having difficulty, managing medications or using their computer or setting the stove dials accurately, that will really, trigger Dr. Day or Dr. Wicker to contact me and say, hey, I think maybe we can take a look and see what we can do. And so I'll set up a time and go to the home, and what I'm looking at is any kind of problem areas, so safety issues, making sure that there's good lighting, good contrast, that you're able to safely operate all of your appliances and do what you need to do to be able to care for yourself. And if you're not able to, then there's usually some different tools that we can use, adaptive equipment. We can do adaptive markings, which is using like stickers or paint to make things easier to see and more visible. And then also just taking a look at any fall risks and helping to modify those.
Oh, that's wonderful. I'm listening because I was like, maybe if I have any future problems, so I know at least there's great help there. And then another question was like, can you be more likely to fall because of low vision?
Yeah, so low vision isn't necessarily going to cause the fall, but it could help trigger a fall. And so that's one area that we are really concerned with in our clinic, is assessing, fall risk, and then making sure that we provide resources to help prevent falls, or have people take more control over, their fear of falling, because fear of falling can be a huge barrier to independence. Maybe not want to go outside or go participate in social events or go to the grocery store. You may feel like you need help. And so every patient that comes through the clinic, we try and do a very quick fall risk assessment on, and it's just a short walking test that we do in the clinic. And that gives us a number that we can use to say, have you had any falls? We can get some more information about that. And then we can do a home safety evaluation if we need to, or we can recommend a program like Matter of Balance, which we run at Kellogg usually 1 to 2 times a year. And that's a free 8-week program that is really geared towards adults with low vision and kind of combating that fear of falling.
So some kind of an exercise?
We do exercises, and we do like group discussion and problem solving. We go through a home safety checklist so we can identify any specific areas. And it's a small group, so everyone has some good time to discuss their specific, concerns or needs.
Yeah. Well, also I want to thank you because you provided us with some questions, because I think that's what probably our viewers would like to know. They're especially age-related because it's senior moment. And so, obviously you need those aids and help, And I think there was one, I don't know if it's a repeat, is there anything to help, with fall prevention?
Yeah, so what I'm generally looking for is we look at this, it's called the timed up and go, is the test that we do in low vision clinic, and it's a very short walking test, and we get a time on it, and that time will tell us if you're at a higher risk for falls or a lower risk for falls. And so if someone's at a high risk for falls, we want to learn more about their fall history and see kind of where the problem is. And so a lot of times contrast can be a problem. So identifying curbs or cuts in the sidewalk, transitions in the flooring from carpet to tile if it's not clear or marked. So contrast can be one thing that we look at, and we can make changes to. So one really, kind of easy way to change contrast is if your stairs are all one color going down, it can look almost like a slide if your contrast is impaired. And so we could even just take a dark contrasting piece of tape to identify the outline of the stairs so that you're able to identify, or even just the top or the bottom stairs, so you know when you've made it to the place that you need to be without
because
falling.
I'm thinking about, you have to be really aware, especially if you have some low vision problem, that you always look on the floor. So I have learned that because I have fallen twice because I didn't look, but it was that now I'm very much aware, and I think that's probably, people should be very aware to always look where you're going and not kind of, and then you'll fall over something.
Right. Yeah, and decreased visual field can cause falls if you're not, able to identify that there's an obstacle in your path. So we do some visual scanning and training with that. But we also have a mobility specialist at Kellogg, and he can actually go out into the community or into the, into stores or wherever you may have challenges, and he can actually do one-on-one training with how to navigate safely and get from point A to point B very gracefully, and it's a wonderful service. And then lighting is also something that we would want to take a look at. A lot of falls happen at night, getting in and out of bed, going to the restroom.
Right, yeah.
So making sure that there's, lighting or safety things in place. Throw rugs are, unless they're tacked down. Or
I'm learning all this, yes.
Yes. So that's really what I'm looking at. And so, each person's home is going to be different and their needs may be different. So it's really looking at where I can make the best recommendations.
I think that's probably where your greatest service is, to check the home, to see where are the obstacles, where you can
that's
really.
My favorite part of my job too, because you really get to know someone and can, identify where their
maybe
concerns
I have
are.
to have you come over to my house and check out.
I'd love to.
I have two more questions. Are there any other devices or services, besides the Kellogg Eye Center?
Yes, so for patients who are legally blind, there is a state agency called Bureau of Services for Blind Persons. You have to be legally blind for us to refer you to that agency. And that's a free service where the counselors can come to your home and do a lot of the activities of daily living. They can also train the patient how to use the white cane and navigate safely. There's also Kalamazoo Blind Training Center, and of course it's located in Kalamazoo, and that is a live-in facility customized for the patient that attends to do everything, from hobbies to cooking to vocational training to computer training, everything like that.
And that's in Kalamazoo?
And that's in Kalamazoo, but that's a referral service. So that's one of them if you're legally blind. Of course, locally in Ann Arbor.
That's what I was wondering, you're right, yeah.
Yeah, in Ann Arbor we house the Washtenaw County Library for the Blind. So again, we have to fill out paperwork. We can help you fill that out. For those who can't read regular books, even large print books, any visual disability will qualify you for that. There's also A-Ride, a door-to-door service for
I have
for
seen
patients
that,
as
right,
well.
yes.
Mm-hmm.
And I think one more question was like are there other technology devices besides, you showed us here?
Yeah, the most common technology devices that we're using now are the ones we carry with us all the time, our smartphones, our tablets, our computers. Pretty much all of those devices have apps and built-in technology that can make them easier to see or actually talk to you, or you can talk to it. So I do a lot of training in clinic on optimizing the display of the computer, your phone, your tablet, and making sure that we have it at the best possible settings for your vision. If you're unable to see it, even with the largest settings, I can also do the training for having it read things to you out loud, or you can dictate to them as well. And all computers and tablets have something built into them. So some of the systems have different apps and programs, but they're there's usually something that we can do to make it easier to use and learn how to use. We also try and keep an updated app list of all the different apps for smartphones and tablets. We have a printed copy that we can give out in clinic, but we also try and keep it updated on the Kellogg Eye Center website.
Yeah, because probably, you always have new technology develops.
Yeah,
right.
And each new thing that comes out has more and more accessibility features built into it, which is so wonderful, but it can be really hard to navigate and know what's there. So it's nice to kind of have someone walk through it with you and turn those features on, make sure they work well for you and that you understand how to use them. And then
I guess we're very lucky to live where we live today, so we have all the technology for us available, for people to help. I want to thank you again for coming and taking your time and giving us all this very valuable information. Thank you very, very much again.
You're welcome. Thank you for having us.
Today, we had Dr. Sherry Day and Ashley Howson from the Kellogg Eye Center and discussed low vision issues. Thank you for watching.
We're so thankful that you have joined us on Senior Moments. Please come again. I'm Linda Brayman, and I wish you a happy Thanksgiving.